Welcome to the Ottawa Hospital. This video will explain what to expect when having an epidural. You may be a candidate for this procedure for your upcoming surgery. The decision to proceed with an epidural will be made on the day of surgery with your anesthesiologist. Please note that, although similar, this video will not address the use of epidural for pregnant women in labor. Please refer to the epidural in labor video for more details. An epidural is used to provide pain relief during and after surgery. Local anesthetic, or freezing medication, is injected into the back near the spine in an area called the epidural space. This numbs the area where surgery will be performed. This procedure is helpful for many types of surgeries, including surgeries of the abdomen and chest. The epidural is usually followed by a general anesthetic, where you will be put to sleep for the surgery. Before your surgery, you will meet the anesthesiologist. They will explain the procedure and answer any questions you may have about the epidural. In the operating room, standard monitors such as a blood pressure cuff, heart rate, and oxygen monitors are used. An intravenous will be started, which will allow the anesthesiologist to give you medications if you need them. You will be seated on the edge of the bed for the procedure. Your back will be uncovered and wiped with an antiseptic solution to reduce the risk of infection. The anesthesiologist will identify and mark the correct area. A small needle will be used to freeze the skin. The epidural space will then be located using another needle. A small tube, called a catheter, will be left in the epidural space and will be secured to your back with a dressing and tape. All needles are removed from your back at the end of the procedure. The procedure takes approximately 10 to 15 minutes to perform, and you will then lie down for your surgery. You may receive some medication to help you relax during the procedure. Most people tolerate the epidural very well. You may feel a pinch or burning sensation when the freezing medication is injected. It is normal to feel a lot of pressure throughout the procedure. However, you may also feel discomfort or pins and needles. If this happens, try to remain still and tell your anesthesiologist exactly what you are feeling. It takes more than 20 minutes for the freezing to take full effect. The epidural is an excellent method of providing pain relief during and after surgery. If your epidural is working well, you will have better pain relief than with other methods, especially when taking deep breaths, coughing, and moving around in bed. This also means that you are likely to require less pain medication, which lowers the risk of side effects like sedation, confusion, nausea, vomiting, and constipation. There is also evidence to suggest that the risk of other complications from surgery may be lowered. These include lung infections, blood clots in the legs, and sluggish bowels. People vary in how they interpret words and numbers. The following scale will give you an idea of the risks involved with this procedure. For example, a risk is considered very common if it happens to 1 in 10 people, or for example, to someone in your family. On the other hand, a risk is considered very rare if it happens to 1 in 100,000 people, or for example, to someone in a city. There is approximately a 10% chance that the epidural does not work well or does not work at all. If this happens, your anesthesiologist may adjust your epidural or use another method of pain relief, most often intravenous pain medications. Very common side effects from the epidural include a decrease in blood pressure, itchiness, or difficulty emptying your bladder while the epidural is in place. About 1 in 100 patients will develop a severe headache after the epidural, lasting days or even weeks. It is uncommon for the epidural to cause temporary nerve damage. Rarely, this nerve damage can be permanent. Other rare complications include serious bleeding, a serious infection, or an overdose of freezing medication resulting in seizure or very rarely death. Becoming paralyzed is a very rare risk associated with the epidural and has never happened here at the Ottawa Hospital. The epidural catheter typically stays in place for 3 to 4 days after surgery. You should be able to walk while it is in place. However, you may be unsteady on your feet at first. Please ask your nurse for help when first getting out of bed. A representative from the acute pain service will see you each day while you have the epidural to make sure that your pain is well controlled. The acute pain service is also available 24 hours a day, 7 days a week for any concerns about your pain management. Removal of the epidural catheter is painless and no further care is required. Please feel free to watch this video again and to ask any questions you have during your appointment in the preoperative assessment unit. Thank you for watching.